Hello?
Mr. Thomas?
Speaking.
It's Dr. Bailey's surgery.
You had an appointment this evening at 6:30.
I am so sorry. Must have completely slipped my mind.
He was concerned that it might have.
Well, it's my partner's birthday. I've been distracted there. Can we reschedule, please?
We could squeeze you in half an hour if that suits.
Just had a cancellation.
Oh. Yeah, yes. I think I better take that. At least I won't forget if I set off now, will I?
See you soon, Mr. Thomas.
See you. I should have put a reminder in my phone.
Happens all the time.
Not a great sign, though, is it?
And no doubt you'll be telling me you haven't noticed any real improvement.
Not really. Does that mean a different dose again?
Possibly. I'd like to try a memory test.
Okay.
Well, it's hard to work out exactly what's going on just by you talking about your day-to-day experiences. A test will give us a rating, which we can then use to chart your progress.
Sounds useful.
We could try it after I've seen my last couple of patients, if you're happy to wait.
I actually have plans tonight. But I am keen to get to the bottom of all this. Yes, I'll wait. Thank you.
It shouldn't be too long.
Okay.
Why 7-12?
I don't know, sweetheart. Maybe because he's lucky.
Doc, bashful, dopey, grumpy, prancer.
I think Prancer's a reindeer.
Doc, bashful, dopey, grumpy, sleepy.
Sneezy.
That's it.
That's only 6. Who's 7?
Happy. Happy 7th. Sorry, he was my daughter's favourite.
How can we forget Happy?
Molly Barrett? I'm going to give you a name and address. After I said it, I want you to repeat it. Now, do remember the address, because in a few minutes I'm going to ask you to tell me again, okay?
Okay.
So, John Brown, 42 West Street, Kensington.
John Brown, 42 West Street, Kensington.
Right, okay. Imagine this is a clock. Now, I want you to fill out all the numbers on the face.
Thank you. How did I do?
25 out of 30.
Good then.
It's what we would consider borderline.
Borderline for what?
Well, it's difficult to say just yet. A score like this does suggest we should be doing more tests.
Well, what would you be testing for? Please.
Signs that your memory could be declining more quickly than it should.
Could it be connected to my epilepsy?
Possibly, if you were having frequent seizures. But you haven't had any of those in a while.
Not for weeks.
It's usually the seizures themselves that disrupt things.
So, what's causing it? My head injury?
Well, it's difficult to get the full picture without all the information. Were you aware of any memory issues before the accident?
Well, I suppose I'd lose my train of thought sometimes. Forget why I'd come into a room, the usual things that come with age.
I'm going to refer you to a specialist.
So you think it's serious?
I think it's worth investigating. In the meantime, I'm going to bring you back in for some bloods, just to rule out any other possibilities.
And once other possibilities have been ruled out, what are we left with?
Well, I can't really give you a diagnosis, I'm afraid. Only a specialist can.
But in your opinion?
I wouldn't want to worry you. Could be unfounded.
I couldn't be more worried than I am now, or more confused. Please, I'd prefer to know, even if it turns out to be something different.
My concern is that your symptoms are unrelated to your accident. Looking at your age and test score, there's a chance that it could be the early onset of dementia. Now, it's just a chance. A specialist will assess you, then after we'll have a clear indication of what's really going on.
All right, then. Thank you.
You'll receive a letter in the post about the appointment. Would you like me to call someone for you? Are you going to be okay getting home?
I'll be fine. I'll be fine.
Okay, well, you take care now.
I will.
So, we're going to solve this mystery then, eh? Kojak, the case of the missing vicar.
I shall put my thinking cap on.
Hey, oh, yeah. Sure, Jack. I like it. Twice the powers.
Thanks for going to all this trouble.
Oh, don't be silly now. Ashley was the driving force.
Yeah, but it was your idea.
Hey, any excuse for a party. Not that you're not special, because you are. You're brilliant. Best PI in the world. Yeah, and all the greats here tonight.
Oh, yes, indeed. Marple, Fletcher, Ironside, Starsky and Hutch, and Flasher in the park.
Flasher? I'm Columbo. Take it back about you being brilliant.
I deduce that Columbo needs to lighten up and have another drink.
Columbo deduces that Sir Jack is right.